Be a reflection of what you would like to receive. If you want love, give love. If you want truth, be truthful. If you want respect, give respect. What you give out will return to you, or it is said, as you sow, so shall you reap. So always try to do good so that you will have good. Now, the types of the lentigo or the liver spots based on the cause and where they appear on the body. Lentigo simplex, most common type, spots appear on the trunk, arms, and legs. It starts at birth or during the childhood. The spots go away with the passage of time. The other type is puva lentigo. It occurs after Soralin and ultraviolet A puva therapy used to treat eczema and the psoriasis. And here one can see the sunspot, or that is lentigo simplex. And here the efficacy and side effect of the puva therapy, one can have the lentigo at the different parts of the body. Then continuing the types of the lentigo or the liver spots, solar lentigo due to the exposure to the ultraviolet radiation from the sun, common in people over age 40 years. Here ultraviolet radiation causes pigmented cells called melanocyte to multiply. It appears on the sun exposed area of the body like face, hands, shoulders, and the arms. These spots may grow over with time. The next type is radiation lentigo, seen in areas of the skin exposed to the radiation for cancer treatment. And here one can see the sunspot, the solar lentigo, and here it is also the due to the radiation, as one can see the marking for giving the radiation, and after the radiation there is a spot which is called radiation lentigo. Now, other types are ink spot lentigo. It appears after a sunburn in people who have lighter pigmented skin. It appears as a dark spot resembling the black ink, so its the name is ink spot lentigo. Then other type is tanning bed lentigo, appears after exposure to an indoor tanning bed. It is similar to the ink spot lentigo in appearance and behavior. So here one can see the ink spot, and there that is the due to the radiation, and due to, as one can say, that is because of patient is lying on the tanning bed, and that also caused the lentigo to appear on his body after using this tanning bed. Now, the diagnosis, how we are going to have the diagnosis, very simple physical examination that tells the lentigo, but in case of any doubt or unusual presentation, one can go for the biopsy to confirm it whether it is lentigo or it is something else. So here one can see by the dermoscopy for lesions, or we can have the skin biopsy to rule out any cancerous lesion. Now, differential diagnosis, lentigo are distinguished from the freckles, aphilis, based on the proliferation of the melanocytes. Freckles have normal number of melanocytes, but an increased amount of the melanin, and lentigo has an increased number of the melanocytes. So that is the difference of the melanocyte number. Freckles will increase in number and darkness with sunlight exposure. Lentigen will stay stable in their color regardless of the sunlight exposure. So here one can see the affiliates and solar lentigen and the moles versus the freckles. So one can differentiate all these from the lentigen. Here is a beautiful painting by a painter. It's unbelievably marvelous. The painter has used the branches of the tree, the clouds, and the nose he has made, that is, he is just painting the girl, the lips. It's just, if you think and concentrate on it, it's really marvelous piece of painting. Now, what is the treatment of the antigen? As I have told you, the antigens are benign. Removed or treatment is for the cosmetic purpose only. These are removed surgically or lightened with the topical depigmentation agents like azelaic acid and kojic acid 4%, hydroquinone 5%, topical cysteamine 10%, and topical ascorbic acid. Bleaching cream containing hydroquinone or retinide, tretinoin. These are the most useful cream used for this purpose. And here one can see the azelaic acid cream, hydroquinone 4% cream, and kojic acid and cysteamine cream, ascorbic acid cream, and tretinoin cream. These are all useful to get rid of these lentigo. Then intense pulse light IPL treatment for lentigo. This treatment emits light waves that pass through skin and target the melanin to destroy or break up the age spots. Some redness or the swelling after the treatment occurs. Other potential side effects include bruising, blistering, skin color changes, or infection, that is just because of the intense pulse light treatment. Then microdermabrasion. This procedure smooths away outer layer of the skin. No recovery time. Side effects include tenderness, swelling, and redness. Stay hydrated and keep the skin moisturized afterward, so that to avoid the side effect of this procedure. So here one can see the intense pulse light IPL laser treatment and microdermabrasion before and after, and one can see clearly the magical difference between the two. Then cryotherapy, it involves using liquid nitrogen to freeze skin of the A spot. This destroys melanin, producing the dark color. One may notice blisters, pain, and swelling. There is a small risk of scarring also. Other side effects include darkening of the spot, lightening of the skin around A spots, or the scarring. Then alternate therapies which can be used to fix double combination such as hydroquinone and tretinoin. I have told you that this double combination is the best used topically, and other are tazarotene and other retinoids can also be used. Dermabrasion, this procedure sands away outer layer of the skin using a rotating brush, so new skin grow in its place. Now skin will appear pink and swollen with a burning or the tingling sensation. Side effects include acne, flares, temporary or permanent skin color changes, redness, scabbing, scarring of the enlarged pores. That is also seen with this dermabrasion. And here one can see the two sessions of the dermabrasion, and after also the cryo surgery on the skin, that is liquid nitrogen is being put to just destroy the area with the melanin. Laser treatment destroys cells that are producing melanin. One requires several visits and several weeks or the months. It has no side effect if it is done correctly. This is most costly removal technique Here, specific wavelength of the light is used to remove the spots. Side effects include temporary darkening of the spot. After treatment, keep the area clean and avoid picking any scabs. Laser therapy effective for the ugly lesion. And here, that is, one can see the myth, fact, and the laser treatment, but one can see the result of the laser treatment. Similarly, one can see the result of the chemical peels, and the magical result of this chemical peel is there. Applying acid to the skin to dissolve its outer layers. New skin forms where layers were destroyed. One have to have treatment several times, and it protects skin from sun immediately after treatment. Otherwise, if you will not protect skin from sun, one can have the serious side effects which include redness, dryness, stinging, or the burning, and the mild swelling. Also, the part of the side effect of this chemical peel. Permanent side effects include scarring, lightening, or darkening of the skin, or the infection. Deep chemical peel can damage heart muscle, liver, or kidneys. Now, there are certain at home treatment which can be tried, but they do not have any clinical proof for its efficacy. These are aloe, green tea, vitamin A, red onion, black tea, over the counter creams, deoxyarbutin, glycolic acid, and alpha hydroxy acid. So that is the end of Lentigines, and I hope you may have liked this lecture. If you will like this lecture, please just subscribe my channel and like this lecture, and just share it with the others. And if you have any question, please feel free to ask me to improve my lecture. And a great big thank you for to be with me and having my lecture.